Welcome to HCA Talks Health. I'm Zina Leroux, and today we have the privilege of having Professor and Dr. Monique Marks as our guest. So Monique is a clinical social worker and a health coach in private practice, and her specialist areas are chronic illness management, substance use disorder, depression and anxiety, and also ADHD. And Monique is also a visiting professor at the University of Stellenbosch, and she's also part of the HCA Rio team. So welcome, Monique. It's lovely to have you.
Thank you, Zina. Good to be here.
So what we'll be exploring today is the very important topic of emotions, and specifically how to hold difficult emotions when working with clients as a health coach. So I just want to start out by exploring this a little bit. So tell me more about what type of emotions do you find are important for our well-being?
So I think let's begin with why people come into the health coaching space in the first place, Zina. And I think it's usually or often because people are not feeling good about themselves. They're feeling that there's something that's weighing them down, both physically and emotionally. And I'm not talking necessarily just about weight, but there's a lack of lightness, if we can call it that, right?
Yes.
And so what they're trying to do is to say, how do I begin to feel more light in myself? Often it's presented as a physical lightness. In other words, how do I lose weight? How do I get more energized? All of that. But beneath that is often a heaviness, which is emotional as well. And so, I work very much in the biopsychosocial model, which means that there is really no real disconnect between our psyche, our biological makeup, and the social environment in which we exist. And so they're all very much connected. So sometimes people come in with an emotional heaviness underneath the biological heaviness. And sometimes people come in with an emotional lightness. In other words, they come in because they want to maintain a positivity, which they already have. But either way, those emotions are really incredibly important to work with.
And when we're working as a health coach, can you give us any tips or tricks on, how do we hold our clients' difficult emotions, or how should we respond to a client that are perhaps experiencing that heaviness or that difficult emotion?
So I think, the first thing that we learn in the health coaching training, which we do, is that we need to be active listeners. And sometimes simply hearing what our clients are feeling and giving them the opportunity to express that, that's the first thing. The second one in that listening is holding space through creating perhaps silence, because you find that when you have silence, that's often when people are able to express what it is that they're feeling. And just being there and waiting for people to say, I'm feeling this, even if it's saying I'm feeling uncomfortable, or I'm feeling anxious, or I'm feeling like I don't know what to say, I'm feeling speechless, right? And then taking what's coming there and sort of paraphrasing it and saying, it seems to me you're feeling X. Let me know if I'm wrong. If you're feeling something different, please correct me, right? So it's allowing our clients also to have the room to say, you know what, that's not exactly what I'm feeling. And then to say, tell me more about what it is. Let's explain it better. It's your emotion. You own it. You tell me what it is, right? So there's a humility there from our sides in saying that we don't always know what other people are feeling, just like other people don't know what we're feeling. And I think it's really useful to have available a sort of a chart which outlines the range of different emotions that people can feel. And people can sometimes point to the emotion that they're feeling. They may not have the word themselves, so we're providing a diction or a vocabulary of words that help people to express what it is that they're feeling. And that in itself is very powerful, is saying, geez, I thought I was depressed, but actually I'm overwhelmed, and then it's a conversation. What we do as health coaches around eating, for example, and trying to find out what it is that makes our clients feel bloated or heavy, or perhaps, getting reflux or whatever it is that is making them not feel well physically, is we often do food mood diaries with them. And that helps us to understand what are the triggers for not feeling comfortable in our bodies. Similarly, it's quite a useful thing to do with emotions, is to say, when you're feeling something, write down when that happened and what you think was the event or the issue that led up to that emotion. So we begin to help our clients in tying the dots together. So much like a food diary, we're doing an emotion diary. And I think it's not something that we speak about very much, but it is really, really useful to say, remember last time we discussed how if you don't sleep well, you start to feel irritable. Maybe that's something that we really need to think about more seriously. Let's get sleep under control so we can break the irritability. Or I'm dealing with the father of my children who I don't live with anymore. And every time I do that, I start feeling like I just get angry, right?
Yeah.
What is that anger about? How do you think would be a good way of dealing with that anger so that you're not left on your own feeling an emotion which perhaps you're not responsible for creating? So it's also just allowing people to problem solve once they can identify where's that emotion coming from, what event or interaction is it linked to? And that is a very powerful mechanism in itself. So what am I saying here? I'm saying identify the feeling word with our clients, and this is very useful with children, very, very useful. The other one is to say, I'm here to listen. I will not be overwhelmed by your emotions, because often clients come in and they feel, oh my God, if I feel chaotic, if I feel sad, if I feel depressed, if I feel all of this, I'm going to overwhelm the other person. So making that person know I can hold that emotion. I am able to do this. This is part of what I do, right? And the third one is to say, let's try and figure out when these emerge and try and sort out how we can, in a way, look at what the triggers are or the causes or the factors that are intervening in our lives that generate these emotions and try and find solutions. What we do as coaches is we often try to get our clients to generate their own solutions, and it's no different with that. And I think there are a number of techniques that we use as health coaches as well, through breath work, through meditation, through centering, which also help people just to say, what is it that I'm feeling? How do I get to a place where I'm able to get to another feeling? So these are all potential tips. And then, of course, there are times when it's very difficult and we need to say, this is out of my depth. I need to perhaps look at somebody else that needs to come in, not to replace the health coach, but to work collaboratively with the health coach.
Yes, exactly. Yes, I think it's very powerful to put words to our feelings, or to just be more clear on, oh yes, that's what I'm feeling. I thought it was, maybe it's sadness, but it's actually overwhelm. I think there's a lot of empowerment in that. But through all of this and being curious about, but what caused the emotion, and let's explore that a little bit. I think we can also help our clients to gain more emotional awareness themselves, and to be able to create more emotional intelligence for them in the long run, to be able to pinpoint it in that way. So you mentioned that sometimes we need someone else, so we need some other form of support. So how do we know? How do we know when it's out of our scope to, when dealing with emotions as a coach?
Well, I think, part of the emotional intelligence that you're referring to, Zena, is our own emotional intelligence, right? And we shouldn't assume that just because we're health coaches that we are at the pinnacle of our own emotional intelligence, right?
No.
And so I think we constantly need to be sort of zoning in and saying, am I aware of how I'm feeling? Am I aware of how my emotions are impacting other people? How can I generate feelings that will allow people around me to feel more at peace, more positive, and so on and so forth? When we feel like, in a coaching setting, we ourselves are beginning to feel overwhelmed, or we are beginning to feel desperately sad, or we are beginning to feel like we are not helping anymore, in fact, that we may be harmful, then we need to say, you know what, I'm going to step back for a little bit. I'm still here if you want to access me, but I would like you to perhaps see somebody else that specializes in dealing with whatever the emotion is. Or many of our clients have been diagnosed with psychiatric conditions. And the reason that they leave psychiatrists is because they feel like they're being over medicated, which they often are. And then it's about saying, okay, let me try and find a psychiatrist that I know well, or a psychologist that is not going to go the medical route directly, if that's what you're not aware of. So again, it's a very important thing. And as health coaches, we do this, is to have a good set of referral specialists at our fingertips that we know, that we trust, that we can say, I know the psychiatrist, and I know the psychiatrist is not going to put you onto 50 different mood stabilizers, because you've done that before, and that's why you're here, because you're feeling totally out of control of your life. So I think it's really doing the research and finding out who's available in the area or who's available online that we can refer to. And I think as health coaches, we should be sharing this information with each other. And then to distinguish whether it's necessary to have a psychologist who will deal really with the mental health issues, or a clinical social worker, say, for example, like myself, or whether there is a need for a medically trained psychosocial person, which would be a psychiatrist. So there are different levels of referring out, and it really does depend on the kinds of emotions, the depth of, I suppose, of overwhelm and discontent that people are feeling, and also whether there are underlying medical conditions that we're aware of. And when there are, we really are responsible to say, I want to continue working with you, but I'd like to do it in association with other healthcare professionals. And I think that's where the role of the health coach actually becomes more important rather than less important, because that's when we become the coordinators of your well-being. Right. That's where we say, okay, you're dealing with a psychiatrist on this issue. You may be dealing with a physician around another issue, and you're feeling like none of these people are talking to each other. And you're coming to me because you're still feeling unwell, both mentally and physically. So my role is to say, I'm going to contain this, and I'm going to bring some kind of sense that you actually know that what each of these people are doing is not speaking across each other, but is actually speaking to each other. And I think that on its own is a huge relief for many, many clients.
I like the idea of a health coach being your wellness coordinator, really figuring out what it is, what are the steps that you need to take. It's not just about changing the way you eat, but it's also about who you approach, who are the people in your life that can support
right.
you. Yeah.
Totally right.
When you're saying that, how do we know when to refer? Does it also have to do with the type of emotions that people are experiencing? So even if we feel like, I can deal with this, I've got the capacity, if there's a certain type of emotion, should we also immediately refer? What are your thoughts?
So if we've got, let's say we've got a client, there isn't a particular type of emotion, but let's say we've got a client who every time they come to us, they say, you know what, I've spent my whole week, I can't stop crying, I can't stop worrying, I can't stop thinking about, I'm obsessing about, the fact that the door's locked, but I'm really worried that the door isn't locked, even when I know it is locked. And you begin to say, okay, there's something going on here. There's an obsessive feeling that's going on, or there's a very deep-seated sadness which I'm unable to really get past. There isn't a particular, or there's an elevated happiness all the time, which is somebody feeling like they can't stop presenting as this person that is always well, always happy, always saving everybody, right? And so then you will be saying, okay, maybe I'm dealing with a bipolar disorder where the person is manic and they feel a need to be excited, happy, on the go all the time. And there is a need to bring that into balance, right? So it isn't a particular emotion. In fact, it could be on what we would generally see as the positive side, but it's not managed. It's not allowing that person to feel that their life is under control or in balance. Then we need to say, okay, what else is going on here? What can I help with? And remember that emotions are, people come into health coaching, again, as I've said, because they're feeling a certain way. And those emotions, for the most part, are what motivates people. So we need to be very clear about what are the emotions that are going to be motivating and what are the emotions that are going to be demotivating. When somebody's demotivated, it's really, really difficult to work with that. Now, there are tools that we have in our box to say, How can we motivate? Like, we can use reward systems. We can overcome obstacles. We can talk about self-limiting beliefs. We can try to work out what are your priorities and organize your time. But when all of that fails, right, and we feel like, oh my goodness, we're still in the same space, then we need to say, let's call somebody else in. I'm not disappearing. And I think, when people are aware, and everybody, is aware when their emotions are out of control, it doesn't matter, how, in what state their lives are in, they are aware, just in the same way that when we deal with people that are at early stages of dementia, they know what is going on. And it's very, very complicated to deal with that, right? So the last thing that a client would want when they are aware that they're experiencing difficult emotions, whatever those would be, is to have a health coach saying, I don't want to see you anymore. You need to go somewhere else, right? So I think it's very important to say, I'm still here. I am still here. I would still love to see you. Let's just expand the team a little bit, but I'm not going anywhere. You still have access to me. And I think with those clients as well, Zena, we do speak about how do we hold our clients accountable in between the times that we see them. For me, this contact with our clients in between sessions is a very different offering than what your classical clinical psychologist or psychiatrist would offer a client. If we say to our clients, you know what, I know that you're going through a very difficult phase emotionally. I am not available all the time, but if you give me the heads up when things are really bad, and I will tell you when I can have a 5 to 10 minute conversation with you just to assist you through this. That is actually a gift that we're giving our clients, which most people don't do, most professionals. And I'm not just talking about people in the allied health space. I'm even talking about lawyers. I'm talking about, most people that see themselves as being professional don't allow for that space. We do. Right? We have a much more human approach to dealing with people. And I think it's allowing for that. What I do with my clients is I say to them in between sessions, I'm not disappearing. You can message me. If you send me a text message, I will respond by text message. If you send me a voice message, I will respond by voice message because I'm taking your cue, right? It's not going to be a long thing, but I'm just going to let you know I'm here. I haven't disappeared. And if you need to speak to me in an urgent situation, just send me a message and I'll let you know what time we can be in contact in that day. Yeah. And the relief that people feel in relation to that is massive. And it is about giving permission, and when we deal with people's emotions, actually I've just come out of a session with a young 22-year-old who, has been worried about what emotion she's placing on her partner. And we've had a conversation about permission, about getting permission to be able to explore emotions. And I think that's what we're asking our clients to do. So we in a way, displaying behavior which then can be taken outside of the coaching relationship. So we're saying, what, just let me know what you need, and I will let you know if it's permissible to do this today, or I may say I can do it tomorrow. And that's something that you can transfer to your other relationships. So if you're feeling like you just need to speak all the time to your husband and you know that he's going to get irritated, say to him, is it possible for me to speak to you now? And if it's not, can we make a time to talk about this? Because I really want to talk about it. And just knowing that he said tomorrow in the afternoon when I'm back at work gives you some certainty. That permission makes a huge difference. And it's a respectful thing to do. So I think those are another couple of tips that I would give, Zena.
And it's about being okay with it, to experience their own emotions, because often it is kind of put under the surface. They don't want to put it out there because they feel like it's too overwhelming, or it's not okay to experience certain types of emotions. So getting that permission, I can imagine, can make the world's difference. But what I'm curious about is, so as the health coach, you've mentioned earlier as well, telling your client that it's okay, I can hold this emotion. But what if that isn't true? What if you can't really hold that emotion? What should you do, or how do you protect yourself? Maybe having that empathy, but without becoming emotionally over-involved.
Yeah. I mean, you know, Zena, that's something that we individually, not just as coaches, but as just as human beings, need to know what our limits are. And so I think we have to be honest with ourselves that if a client is leaving us feeling depleted and overwhelmed, it may not be good for us either. And if it's not good for us, then it's not good for our clients. And then we do need to say, you know, it's been really great getting to know you, not to say you're making me feel overwhelmed, because that's just going to make somebody feel uncomfortable about themselves, but to say, I really think I know somebody who I think would be a great person for you to talk to. And I'm always going to be here. You know, again, it's being very conscious that people that do experience intense emotions often do experience abandonment, and they do feel that people are, you know, leaving them all the time. So we need to make that very clear, while protecting ourselves as well. We're not going to be able to deal with all clients, you know, and that's why, you know, I'm not going to take on, you know, some of the issues that other health coaches deal with. It's not my area of interest or my area of specialization. So I would be, you know, if I wanted to, you know, I often get messages from people, can you be a fitness instructor for this person? I'm a fit person, but I'm not a fitness teacher, right? That would be absurd for me to do that, right? And so really being very clear about what is our ambit that we can cope with is our emotional intelligence as well. And we need to tap into what we're feeling during a session and at the end of a session. And if at the end of the session we're not feeling good, and that can come from just feeling, you know, that I don't know how else to put it, but that our space is no longer clear, or that we feel that we actually haven't helped this person at all. In other words, we feel inadequate. Then we need to rethink how useful we are in that client's life, because us feeling inadequate is not going to help our client at all. And the nice thing about, for example, HCA is that, you know, there are networks of health coaches. So, you know, for example, if I'm not coping well with a client for whatever reason it is, maybe they're triggering something in me, you know, then I can say, you know, with respect, there's somebody who I know really well, and I'm recommending her to you. Zena, for example, Zena would be a good person to deal with. And let me know how it goes. I'm always here. I'm clear. I'm keen to hear your feedback. Even call me to let me know how it's going, you know, that kind of thing. So I think what we need is our own emotional intelligence, and also to recognize that we have triggers, we have limits, and just to be conscious of those. And it sounds easy, but it's actually not, you know, because tapping into our own emotions when we're dealing with other people's emotions takes time, right? And that is why I think, you know, another technique which is really important is ensuring that we don't have one client over the next client over the next client without having time out in between clients, right? So we do need to say, in each of our cases, how long do I need to center myself again before the next client, you know, and that is critical. So in some people it may be 15 minutes, in other people it may be half an hour. Other people may say, I actually need to go for a walk. Walking is really important, give me an hour. So I'm only seeing 4 clients a day, let's say, for example. But knowing what that buffer time is also important in terms of our own mental health. Let's not assume that just because we coaches or social workers or psychologists or whatever, that our mental health is optimal either. Having said that, debriefing when we're dealing with difficult emotions becomes critical. So it is important, if I'm feeling overwhelmed by my own experience with a client, that I'm able to phone another health coach or another social worker or psychologist and say, I've got a really complex client that is presenting with these emotions. I'm not sure if I'm adequately dealing with it. Could I have a conversation with you about this? There are various ways that we can do this, Zena. We can obviously pay somebody to supervise us, which is what most people in the mental health space do. They have a supervisor or they have their own therapist. But in the health coaching space, what I think would be a really nice thing to do is either we have sort of communities of practice where we can talk about difficult cases while maintaining confidentiality, or we have a bartering system where we say, Zena, you know what? I know that you're really good at fitness. I'm feeling like I'm not reaching my fitness goals. If I can like get that with you going, you feel free to talk to me about the difficult emotional spaces that are coming up, So it becomes like, we become less isolated in our practice, and that helps as well.
Yeah.
And just knowing who it is in that community of practice that we feel that we can be our raw, honest, and intimate selves, and that's not everybody. So we have to find our safe people as well as we
Definitely.
navigate the space of emotions.
Yeah, I think the debriefing is really key, but also figuring out what your own capacity is. How
Yeah,
much time do you need in between sessions to center
yeah,
yourself, to feel grounded again? And I've found that, those things are just as important, if not more important, than
yeah.
doing marketing or making sure that you put your
Totally.
post on Instagram or whatever is just as important a part of building your business and making sure that it's sustainable in the long run, because you
Mm.
are your business. So it's so important to do that type of work as well, to be able to show up and to be able to hold that space for a
Yeah.
client.
And also in acknowledging our feelings, and this is something that I think we often don't think about, but acknowledging how we feel about what a client is saying,
Yeah.
to say like, you actually, when you tell me that story, it makes me feel really sad.
Mm,
It's actually just showing that we are human too, right?
mm,
And it's not a flaw, it's not a fault, it's not a deficit. It's a sharing of humanity with our clients. It's saying, yes, it does have an impact on me, and it's okay. I'm not overwhelmed. I just
mm,
am sad to hear that you have had such a difficult situation, right? In the psychosocial world, we also use a term called immediacy, which is when you constructively share something from your own experience with your client, but it has
mm,
to be with a purpose, right? So let's say, for example, you've got a single parent who comes in and they say, you know what, I've just had the most terrible experience with the father of my children, and I don't know where to put my anger. And you've had a similar experience as a single mom, and you can say, it's not something that I would generally share, but actually, when my kids were 2 and 5, I had the same kind of experience that I went through, and this is how I dealt with it. It may be useful just as information. If it's not, then let it go, right?
yeah.
But immediacy, when used correctly, does like allow our clients also to recognize we're human too, and we can relate, right? So what we have then, which I think is really important in health coaching, is what I call bidirectional relationships. The relationship is not a one-way thing. It's not like
Mm,
going to a psychoanalyst who sits
mm,
there and is like just like somebody you speak to, but they have no way of connecting. In fact, it's part of the way that therapy is done by a psychoanalyst is not to show emotion, right?
mm,
So it's all based on transference, it's all based on their emotion.
mm,
We are not that. We are saying, this relationship is a two-way thing, right? I'm allowing you to guide the space, and I'm there to support, to give encouragement, to challenge, to provide information. But I'm also interested in what information you have, because there may be things that that I don't know, right?
mm,
So all of this, again, I'm going to use the word humility, because humility is very, very nice. And recently I was in a webinar, which was focusing actually around difficult emotions with Aboriginal people in Australia, and this was with a group of social workers. But nonetheless, the person who heads up the social worker said, let's get away from talking about cultural sensitivity or cultural diversity and talk about cultural humility. In other words, the idea that we don't always understand where people come from in terms of their cultural setting or even in terms of their emotional setting. So, this idea that I have humility, I come in here not knowing everything, is a powerful thing as well. And it makes our clients feel that, we are none the better than each other. We're all navigating difficult emotions all the time.
mm. And I've even experienced that in everyday conversations. The moment you
Mm,
are honest and a little bit vulnerable about what you've experienced, just accepting your humanity, then people tend to also open up. And it's easier
yes,
for them to share what's going on for them, and it kind of makes it normal. It gives them permission to be honest.
yes,
We don't have to
yes,
pretend that everything is fine all the time or that you've got everything sorted. We can be honest about what we are
yes.
experiencing. Yeah.
No, with the caveat that we don't want to overwhelm our clients, right? So we have to be very careful that we share in an authentic way. If I'm to put a term to what you're saying, is to say we're being authentic. So somebody comes in and you feeling like, it's just been a very rushed, busy day, and you're feeling a little bit harassed, you can say, just excuse me for a minute. I've had a really hectic day. I'm fine. I'm okay. But it has been a bit of a hectic day. So if I'm like a little bit all over the place for the first 5 minutes, please excuse me. But just to reassure that you're fine, that person doesn't have to worry about you. But it's okay to say, I've had a hectic day, or my partner's really sick at the moment and it's just been a little bit of a destabilizing period, but I'm managing, I'm okay, right? So it's just that, which makes it a little bit different from a friendship where you can say, oh, you know what, I am just going to go to bed for a week and never want to surface again. We're not going to say that to our clients.
No, it's
Sorry,
not the
Zena,
same.
you were going to ask something else.
No, I was just thinking about everything that we've discussed and just want to make sure that we've covered everything. So is there anything else that you feel like is important that we should still touch on, that would be maybe important to leave our listeners with?
Well, I think, the one thing that comes to mind, and we don't speak about it a lot as health coaches, is dealing with minors, and how this works with children. And because children come in and obviously they have much less of a capacity to deal with their emotions, and we really need to be guiding that. And so I think with children, creating a safe space often means not asking questions that are direct. It's allowing them to come out with their feelings in whichever way they feel most comfortable. And so actually often with children, when we're dealing with them as health coaches, is to allow them to be very distracted. So often you'll find if you're dealing with a client, while they're drawing a picture, they'll be talking about what they're feeling, but they need to be drawing that picture. They don't want to be sitting one-on-one as if they're in a therapy session, right? That is not going to work for children. So making sure that if you're dealing with children, that you have things that they can do while they're with you, which may mean all you are is a safe space trying to work through something. And this happens a lot when you're dealing with kids with ADHD, right? You're not going to be able to sit and say, let's talk for an hour about how you're doing at school, right? Because they're going to look at you like you totally don't understand them at all, and you don't, right? So it's just about being very sure that we have the tools around us. And in this case, I'm not just talking about our toolbox, which is our skills, but we may need to have with us, like I have in my office now, I have toys, I have crayons, I have paint, I have various different things. You'll see around you lots of colors in my office. It's just that I know that, just allowing people to feel that the space is warm, comforting, vibrant makes a huge difference. Just so happens your and my color are exactly the same, which is very interesting. Yeah, I'll show you just now. So I think, children is the one space that we don't talk about enough as health coaches. And yet I think that it's often, if we can get into assisting children when they're young with their health issues, again, across the spectrum, then we actually prevent people from needing to come to us later on in life. So recognizing, if a mother comes in and they say, my child is like overweight, not saying that's okay, saying, you know what, let's try to deal with that. Bring them to me with you if you want to. Come together. Let's talk about how we can enjoy eating without, feeling that we're going to be putting on weight. Because kids that are overweight do get teased, and it does become a problem, right? And then it becomes a mental health problem and not just a physical problem. So I think, it's a beautiful space to be working in, but we need to be equipped to do it, and it's not an easy thing to do. So even if we do just a short play therapy course, I think that that's really useful for coaches that are wanting to deal with young kids and those that are based in schools, right? So that may be the one thing that we haven't spoken about, but it does come to my mind. The other thing that comes to mind, when I first went into private practice full time, is that I was called upon by a neurologist specialist. He was dealing with a young 16-year-old who was in paralysis, but the paralysis was not biologically based. In other words, there was no physical cause. So it was what he called pseudo paralysis. Now, he had no idea how to deal with the pseudo paralysis. You know, he'd put him on epileptic medication. I have no idea why. But anyway, he called me and he said, I don't know what to do with this kid, right? So it was just a matter of saying to this child, what is really going on in your life? Just tell me what's going on, right? And then it turned out that there was, you know, a whole lot of abuse between his mom and his mom's partner, who was not his dad. And that actually, the pseudo paralysis was actually a manifestation of his mental paralysis. And so what I did with him, it was a very simple thing. I just did a trauma release with him. That's all I did. And by the next day, he was walking again, right? It was not a magical thing, but it was just allowing the space to deal with emotions with somebody who didn't have a white coat on, who was not Dr. Say, okay, I'm doctor, but that's not my medical title. And to say, I can express that, and to call the mom in. So the point that I'm making here is the simplest of tools of allowing people to express their deepest fears, their deepest concerns. If you're able to contain that, makes a world of difference. And then to bring into the room the people that are required. You know, so if I was just dealing with this kid and not bringing mom in and saying, Mom, you know what? I know you're trying your best, but your kid is having a real problem with your partner. We need to talk about it. So, in other words, when we see somebody, recognize that they're part of a social system. And sometimes bringing the people from the social system in is something that we need to do as health coaches. And again, it is a little bit left of field of our usual way of dealing with things, but sometimes it's really important because our relations with other human beings affects our health very dramatically, not just disconnect and loneliness, but also the nature of the connections that we have with other human beings.
Absolutely. So yes, I agree, and it's not just about what we do in the therapist's or the coach's office. It's also what the real life therapy, going out there, having conversations, or have someone supports us to have those types of conversations that are needed for us to have a safe and a healthy space in the real world. I think is so important. So Monique, where can people find you? Where can listeners find you if they want to reach out to you?
Sure. So, okay, I can give you my my WhatsApp and phone number if you want, which is 084 403 3934. That's a South African number for people that are not in South Africa. And then I also do have a website. So if you just look up Your Health Prof, www.yourhealthprof.com, you will find me there. Otherwise, my email address, which is my name, which is a long thing because it's my full name. So it's Monique Marks at gmail.com, or Monique at HCA, either one of them. So you can find me there. And if you want to find me in person, for people that are Durban based, I'm based at the Sparks Lifestyle Centre, which is in Overport in Durban. But I'm sure if people do want to get hold of me, they can just contact HCA, and HCA will give my contact number. I'm not that difficult to find on the internet, Zena. So if you just look Monique Marks Health Coach, you'll find me.
And we'll also put the details in the description of the podcast, so people will be able to find it there. Yeah, so thank you so much. I think it's a very important conversation to have, to firstly know what the tools are, or how we can support clients to bring difficult emotions to the session, but also supporting ourselves. Knowing how to debrief, knowing how much capacity we've got, what we need in between sessions to be able to show up in a sustainable way. And I think also knowing that it's okay. It's okay to have any type of emotion. All emotions are welcome in a coaching session, but we do need the tools to deal with them adequately. So thank you. Thanks for the important work that you're doing, and also for sharing your knowledge with us today. If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.